Which of the following is the first step in setting up a cardiopulmonary bypass (CPB) circuit? A. Check the oxygenator and heat exchanger functionality. B. Ensure all cannulas and tubing are sterile. C. Verify the correct functioning of the pump oxygenator unit. D. Check the arterial and venous lines for leaks. Answer: B. Ensure all cannulas and tubing are sterile. Explanation: the first step in setting up a CPB circuit is ensuring that all cannulas, tubing, and other components are sterile to avoid any risk of infection during the procedure. This step is crucial before proceeding to functionality checks. What should be checked to ensure that the CPB circuit is free from air before initiating bypass? A. All clamps should be closed on the venous line. B. The bubble detector must be activated and calibrated. C. The oxygenator must be tested for leaks. D. The arterial line must be flushed with saline. Answer: B. The bubble detector must be activated and calibrated. Explanation: the bubble detector is a critical safety feature of the CPB circuit. Before initiating the bypass, it must be calibrated and activated to detect any air in the circuit, preventing air embolism, which could be life-threatening. During CPB circuit setup, which safety check is performed to prevent excessive pressure on the venous return? A. Checking the oxygenator membrane integrity. B. Ensuring the venous reservoir is at the correct level. C. Verifying the arterial filter is installed correctly. D. Testing the safety alarm system for pressure settings. Answer: B. Ensuring the venous reservoir is at the correct level. Explanation: the venous reservoir should be checked to ensure it is at the proper level to prevent excessive negative pressure from occurring, which could lead to collapse of venous lines or air embolism. Proper filling prevents suction issues that can affect the venous return during bypass. Which of the following safety checks is most crucial when the CPB machine is turned on for the first time? A. Confirming the pump speed is set at the prescribed rate. B. Ensuring that the arterial line pressure transducer is correctly calibrated. C. Verifying that the oxygenator is primed with appropriate blood volume. D. Checking that the venous cannula is positioned correctly in the right atrium. Answer: B. Ensuring that the arterial line pressure transducer is correctly calibrated. Explanation: proper calibration of the arterial line pressure transducer is essential for accurate monitoring of the patient's blood pressure during bypass. Any discrepancies in pressure readings can lead to unsafe adjustments in pump flow rates and jeopardize the patient's well-being. What is the role of the safety alarms in a CPB circuit setup? A. To monitor the patient's oxygen saturation levels. B. To detect mechanical malfunctions or faults in the circuit. C. To adjust the flow rate automatically during surgery. D. To check the temperature of the perfusate. Answer: B. To detect mechanical malfunctions or faults in the circuit. Explanation: safety alarms in the CPB system are programmed to detect faults such as low pressure, air in the circuit, or high flow rates. These alarms provide early warnings of potential mechanical failures that could compromise the patient's safety. Which of the following is most important when preparing the CPB circuit for use? A. Setting the temperature on the heat exchanger. B. Pre-warming the venous blood reservoir. C. Testing the oxygenator for leaks. D. Flushing the circuit with heparinized saline. Answer: D. Flushing the circuit with heparinized saline. Explanation: flushing the CPB circuit with heparinized saline helps remove air from the system and ensures that the circuit is primed with anticoagulant before the patient's blood is introduced. This reduces the risk of clot formation during bypass. Which of the following is a critical safety check when the CPB machine is in operation? A. Ensuring the oxygenator is delivering the required amount of oxygen to the patient. B. Checking the patient's temperature at regular intervals. C. Monitoring the venous drainage for signs of overcirculation. D. Confirming that the cannulas are adequately secured. Answer: A. Ensuring the oxygenator is delivering the required amount of oxygen to the patient. Explanation: the oxygenator plays a vital role in maintaining oxygenation during CPB. It is essential to ensure that the oxygenator is functioning properly and delivering the required oxygen concentration to the patient. This is a primary safety concern, as any malfunction could lead to hypoxia or organ damage. Which of the following is the most critical consideration when preparing the CPB circuit to avoid potential risks during the procedure? A. Ensuring that all clamps are in place on the arterial and venous lines. B. Verifying that the anticoagulation levels are adequate before bypass. C. Confirming the accuracy of the bubble detection system. D. Testing the oxygen supply to the oxygenator. Answer: B. Verifying that the anticoagulation levels are adequate before bypass. Explanation: ensuring that the patient has adequate anticoagulation before initiating CPB is essential to prevent clot formation within the CPB circuit. This is usually achieved by administering heparin and monitoring activated clotting time (ACT). What is the purpose of a venous reservoir during the CPB circuit setup? A. To warm the blood to body temperature. B. To store blood returned from the patient during bypass. C. To filter emboli and microclots from the blood. D. To provide a backup supply of oxygenated blood. Answer: B. To store blood returned from the patient during bypass. Explanation: the venous reservoir serves as a collection area for the blood returned from the patient during cardiopulmonary bypass. It helps to maintain a constant blood volume in the circuit and ensures that venous return does not create negative pressure that could collapse the venous lines. What is the primary function of the arterial filter in a CPB circuit? A. To ensure adequate oxygenation of the blood. B. To filter out air bubbles and microemboli. C. To monitor the patient's blood pressure. D. To control the temperature of the blood. Answer: B. To filter out air bubbles and microemboli. Explanation: the arterial filter is designed to remove air bubbles, microclots, and other debris from the blood before it is returned to the patient. This is crucial to prevent embolism, which can lead to serious complications such as stroke.